I knew that I always wanted to be a doctor growing up, and I never thought of being internal medicine. I always thought of being a surgeon. And as I was in medical school and started to rotate through the various subspecialties in surgery, plastic surgery really appealed to me. And it gave me a chance to use my artistic side, but still be involved in science and medicine. Coming through school, some people felt like they wanted to specialize in reconstructive surgery, and others knew that they wanted to do cosmetic surgery. And in my mind, it's an artificial boundary between the two. And if you're doing really good reconstructive surgery, then it's aesthetically pleasing. And if you're doing really good cosmetic surgery, then you're reconstructing the natural, beautiful, youthful anatomy. The cosmetic work that we do in breast surgery has helped me in the reconstructive work that we do. Patients that are unfortunate to have developed breast cancer, we feel we can soften the blow of the experience of mastectomy by providing breast reconstruction at the very same time that their general surgeon performs the mastectomy. And the things that we've learned about cosmetic breast surgery has helped us push our reconstructive surgeries to a higher aesthetic level. I was drawn to surgery because from the scientific side I have a love for anatomy. And it's truly like exploring and going into uncharted areas. You can go to the book and it says that this muscle is here or that nerve is there, but when you're doing an endoscopic facelift and you come around the corner around the cheekbone and there's a muscle of facial expression and you know that right next to it is an important nerve, it's like being an explorer, and it's exciting. When I was in plastic surgery residency at Duke University, there was an exciting time in surgery. The whole concept of minimally invasive surgical procedures had been introduced, and I had trained in general surgery in Miami and been involved with procedures to remove gallbladders to the belly button using laparoscopes. And during my research time at Duke, I wanted to be a part of minimally invasive plastic surgical procedures as well. And so I had a chance to do research for 6 months and develop some instruments that I still use today for endoscopic breast augmentation. And this is a procedure where we can make an incision in the armpit and avoid any scar on the breast at all. And the balloon dissectors that I developed open up a space so that through a very tiny incision we can get access inside the body and begin to work and make room for the breast implant. So this whole field of operating through tiny incisions far away and doing as little damage as possible is referred to as minimally invasive surgery. I think an extension of that applies to the work that we do in facial plastic surgery as well. And the whole idea there is to make people look truly younger and not like they just had a facelift. And sometimes that involves an endoscope and small incisions in the scalp to lift the brow or the face. But more importantly, it applies to the idea of making people look truly younger and not just pulled tighter. I think as human beings, we're looking to gain control of our lives and, if you will, reinvent ourselves. And we're constantly looking for better. And that's the beauty of plastic surgery. It offers that age-old desire to take control of our environment and ourselves and improve upon it. The real joy of being a plastic surgeon is we have the luxury of time to get to know our patients. More so than making someone younger or improving their figure, we're really touching people's lives, and they come to us and share with us areas that are troubling to them that they want to improve, and then we have a chance to step in and play an important role at an important time in their life, and that's very rewarding. For years, we went to the local hospitals and surgery centers and did our surgery there. And plastic surgery patients are just different than the other patients in the hospital, especially cosmetic patients. They're not sick, and so it's tough to bring them to a hospital where there might be a lot of sick people. And they need a little more privacy and individualized care. And so we really wanted to build a center where we could cater to our patients and control the whole experience from start to finish. And so that's why we developed the Center of Surgical Excellence. The names are very important, and so we chose that name to inspire us to excellence and to always remind us every day that that's what we're here for. And as a team, I'm so fortunate to work with so many wonderful nurses and doctors, and the common theme that binds us together is that we all care about people and we're interested in helping take care of them. For the past 2 years, I've had the pleasure of accompanying my brother and 2 other surgeons from Saint Petersburg to travel down to Antigua, Guatemala. And while we're down there for a week, we've done approximately 70 surgeries in that week's time. And it's a wonderful trip. The people are very lovely, and they don't have any expectations that they deserve anything in medical care, and it's such a pleasure to go and help them. And these are people that, without faith and practice, the mission that we go with, really would have no opportunity to get taken care of.
I have been going the last 2 years as the cook for the team. I cook for about 40 people and 2 meals a day, and it's quite challenging, but it's very, very rewarding.
When we came back from the mission trip, I almost hesitated to mention it to people because they feel like, oh, well, that's a great thing you're doing. And I said, no, you have to understand, I get so much more out of it than what I've given while I'm down there. It's just a wonderful experience.